Hi there, folks. My name is Michelle, and I'm going to talk to you today about the Modified Early Warning System. So, what is the Modified Early Warning System, also known as Mews? It is a tabulation or score of vital signs that can be used as a predictor in impending adverse events. Because I'm a visual person, I want us to go ahead and take a look at a couple of different Mews tables. This one is courtesy of Providence, where I work. It's a very simple table. It utilizes the blood pressure, the heart rate, the systolic, the respiratory rate, and the temperature. This next one's a little bit more complex. It involves respiratory rate, heart rate, systolic blood pressure, level of consciousness, temperature, and hourly urine output. So let's talk about what Mews is. One definition could be stated that it is an early warning system as a proactive tool that members of the multidisciplinary healthcare team can use to identify changes in patients' status by considering physiologic parameters such as blood pressure, respiratory rate, heart rate, and neurological status. Where did Mews come from? It was first introduced in 1997 by Morgan, Williams, and Wright as an objective physiologic measurement of the patient's vital signs to detect the earliest indications of patient deterioration. So since then, how far has Mews come? It is now listed as a nursing tool on the Agency for Healthcare and Research Quality, which states the Modified Early Warning System, Mews, is a tool for nurses to help monitor their patients and improve how quickly a patient experiencing a sudden decline receives clinical care. The color-banded patient chart gives a visual cue as to when to calculate a Mews score. Now I want to stop here real quick and just remind you that the Mews score can be calculated on paper or it can be calculated automatically by the electronic health record. So let's talk about using Mews. Again, the scores can be calculated using pen and paper, and sometimes it is automatically generated and built into the EHR. Who uses it? Well, by looking at the research, just about anyone taking care of patients can use it. It can be initiated in the emergency department and used throughout from admission to discharge. It is also being studied in obstetrical and pediatric wards. However, I am only covering the adult application of the Mews table today. When we talk about interpreting a Mews score, we need to remember that it is an assessment tool and that while anyone who is taking vital signs can generate a Mews score, the resulting assessment tool needs to be done by a nurse or a physician. So does it matter how old the patient is or the gender in talking about the adult patient? No. The research supports that this is an effective tool for the adult population. In a study done by Gardner Thorpe et al., the ratio of male to female was 1 to 1.02 with a mean age of 58.6 in using a Mews table and its effectiveness in decreasing in hospital cardiac arrests and adverse events. When does it matter? Mews is often incorporated with a hospital's rapid response team who responds to a score that is set by the hospital. Some hospitals have it set at 5, others use 7. Once you have your score, you need to escalate the patient's care either by assessment by the rapid response team or a critical care MD. Usually your hospital will have a defined protocol for escalating care. Elevated scores may result in a transfer of the patient to a higher level of care. So why does Mews matter? Well, looking at some research, community hospitals found an increase in their rapid response events after the implementation of the Mews, but with that, a decrease in their in-hospital cardiac arrests. A hospital in Japan saw a decrease in their hospital cardiac arrests from 5.21 per 1,000 patients to 2.05 per 1,000 patients. And most recently, a study done by Urban et al. Felt that it was actually going to be a helpful tool in predicting the need for admission in emergency department patients. So let's look at what some of the pros and the cons are of using Mews. One of the biggest pros is having a set score that triggers a rapid response team means that you get an extra set of eyes to aid in evaluating your patient. Are they having a decline or is this something else? One journal suggests that there is a better communication between the disciplines as a result of Mews and rapid response team interventions because now you have this increased collaboration between providers, a critical care nurse talking to a med-surg nurse. You know, this is now a learning event. Did this need to be a rapid response? Yes or no? Why or why not? And the same thing goes for your intensivists versus your critical care intensivists. So what are the cons? Well, having a preset score that automatically dispatches a rapid response team means that at times you are going to have inappropriate dispatches of the rapid response team if it does not take into account the full clinical presentation of the patient. So that is definitely a downside, and that could cause some burnout for people on the rapid response team, so that is something to consider. What can we take away from this? Well, multiple studies have shown that Mews is a useful tool to aid in determining if a patient is acutely deteriorating. It essentially is giving us the opportunity to jump on ahead of them having a in-hospital cardiac arrest or other sudden life-altering event. I feel strongly that all providers should take the Mews score into consideration when evaluating patients for rapid response or for potential admission status. It should, again, be used in conjunction with the rest of the patient's clinical presentation. This is just a few references that are available out there. These are what I used for my slide. However, there is an abundance of information out there on using Mews in facilities, and it looks like this really is the direction that we should be going in healthcare when it comes to providing safe in-hospital care for our patients. If your hospital uses Mews, I encourage you to become familiar with what the score is that would trigger a rapid response team. And if your hospital doesn't use Mews, I would encourage you to become active in the education committee and see if you can get Mews to be part of your hospital's protocol. Thank you very much for your time, and I hope you learned something.